Hi, my name is Justina Tan. Thank you for giving us the opportunity to present our research here today titled The Age and Population Adjusted Trends in Inpatient Surgical Management of Vaginal Prolapse, Rectal Prolapse, and Concurrent Vaginal and Rectal Prolapse Surgery in Washington State. I have no affiliations to disclose. Now, vaginal and rectal prolapse in women have a common pathophysiology, and the incidence of concomitant uterine or vaginal prolapse with rectal prolapse is variable and has been reported in some analyses to be up to 38%. And despite the shared pathophysiology, vaginal and rectal prolapse has traditionally been treated as separate entities. However, multidisciplinary approaches have been demonstrated to be safe and efficacious and may improve surgical outcomes and patient satisfaction. Prior work has demonstrated that there has been a trend towards performing concomitant procedures by colorectal surgery and urologists or gynecologists, demonstrating that the national rate of multidisciplinary repairs has increased from less than 1% in 2003 to nearly 2% in 2017. In this study, we report the age and population adjusted trends in the prevalence of inpatient vaginal prolapse, rectal prolapse, and concurrent vaginal and rectal prolapse surgery in women in Washington State over a 12-year period. We queried a Washington State administrative inpatient claims database between the years of 2008 and 2019 for women over the age of 20 who had ICD-9 and ICD-10 diagnosis codes and procedure codes for vaginal and/or rectal prolapse. Procedures that were performed on the same day were considered to be concurrent, and demographics and rates of surgery were analyzed. These rates were adjusted by age, population, and gender based on Washington State Census results for 2008 to 2019. A total of 17,000 patients were identified in our study, and the majority of these women were noted to be less than 80 years of age. 85.6% of these women who were identified underwent vaginal prolapse surgery alone, and 5.1% underwent combined vaginal and rectal prolapse repair. 95% of those who underwent combined surgeries were noted to be less than 80 years of age. And in terms of ethnicity, 52% of the women who were included in the study identified as white, and less than 5% were noted to be in minority groups. Unfortunately, no data on patient ethnicity was provided for 43% of women in the study. When we look at where our patients are receiving their care, we see that 75% of all women who receive vaginal prolapse surgery alone, rectal prolapse surgery alone, or concurrent vaginal and rectal prolapse inpatient surgeries were performed in the 7 most populated Washington State counties. And the majority of all combined vaginal and rectal prolapse surgeries were performed in a single county, that was King County. In terms of where our patients reside, the majority of our patients who were identified in the study were noted to be residents of 5 counties, and 75% of these patients lived within 20 miles of their treating facilities. And when we looked at the top 15 centers in Washington State that treat prolapse, we see that many of these patients actually reside less than 20 miles away from their treating facilities. In fact, 2 centers were noted to have a patient population comprised of nearly 95% of patients who resided less than 20 miles away from their facility. And from 2008 to 2019, we see that the number of inpatient admissions for concurrent vaginal and rectal prolapse surgery and rectal prolapse surgery alone remained relatively stable, while the number of vaginal prolapse alone surgeries decreased. Overall, our study suggests that the concurrent surgeries were performed in the most populated areas of Washington State, and we see that there does appear to be a decrease in the rate of inpatient vaginal prolapse surgeries. However, as this was an inpatient database alone, the vaginal prolapse surgery rate will not include outpatient surgeries, and the decrease in inpatient procedures here could actually represent a shift towards outpatient procedures. Finally, despite the fact that nationally there has been a reported increase in the rate of concurrent vaginal and rectal prolapse surgeries, the same trend has not been seen in Washington State. This could be due to many factors, but prior work may not have accounted for the role of aging and the growing patient population who may have a higher incidence of pelvic organ prolapse. And these results suggest there is room for improving the utilization of multidisciplinary care in Washington State. Thank you.